So we're going to begin with counseling, and that's going to consist of, most often, going to consist of smoking cessation, walking therapy, and then the use of some medications to help blood vessels enlarge to carry blood around blockages in the legs. These are done for people who are what we call claudicants, where in situations when a person walks, the calf muscles get tight, the gluteal muscles get tight, and exercise therapy, smoking cessation with the addition of some medications, and actually working on this have been shown to relieve the symptoms of claudication and enable someone to walk further. If this doesn't work, then we proceed with more invasive imaging, which can come in the form of a CAT scan or an arteriogram. With the arteriogram, a needle is placed in the groin and wire and catheter are advanced up into the aorta and then down the other side. So if we're working on the right leg, we needle puncture the left groin, go up to the aorta, and then come down the left leg. At this point, we use dye, whether it's carbon dioxide on patients who have renal failure or regular contrast, and we get an understanding of that patient's anatomy and what we need to do to work with them. At that point, we have an option of using balloon angioplasty, which is inflating a long, skinny balloon into the blood vessel itself to open it up. There's also the ability to perform an atherectomy or to manually manipulate that plaque and prepare the blood vessel wall for further therapy. And then there's stenting. With stents, there are two kinds. There are covered and non-covered. And depending on where we're working, we'll really decide which stent that we use. Other therapies consist of drug-coated balloons. That balloon is coated with paclitaxel. It's actually a chemotherapeutic drug. It's the same medicine that people get for cancers. And if you've seen someone who's been treated for it and they may have hair loss or fingernail loss, that's because that medication is targeting cells on the inside of the blood vessel that reproduce quickly. And so when that cell growth is stopped, these blockages do not come back as soon.